Chris with Rowe Dental Laboratory. We are a full-service lab and work with doctors all across the country, surgically and restoratively, to get the patients the smiles that they're looking for. Some of those cases that we do are overdenture cases. Now, these can be some challenging cases that take up a lot of chair time depending on the case and depending on the patient. Sometimes with these overdenture cases, the patients may not be happy with their final outcome, or they may be functioning in their overdentures for a few months or a couple years and decide they want something different. They're just not happy. Now, we refer to these cases as revision cases. So whether it's surgically or restoratively, we can help you out with these revision cases. We can, put our heads together and come up with some pretty unique solutions to get these cases done surgically and then ultimately have an updated or new restoration for your patient. So here we're going to talk about a couple different scenarios for revision cases and how we can help. So in this particular scenario, we're going to be discussing a patient that has 2 implants. So it's a 2-implant overdenture, and they're just not happy and they want to go something more stable or even get into something fixed like a Locator fix solution. Well, there's a great solution out there with Locator fix, but we have to get there surgically first because those have to be on 4 implants. So we can help you out with the revision surgery. And again, give us a call to discuss the different options as to how we can get you a nice surgical guide to get those 2 additional implants placed. Now, once those implants are placed, typically that's where the work really starts restoratively in the chair. And it can be multiple appointments. But we have a couple different solutions for you in this scenario. The first would be if you are confident in picking up the housings chairside. That's a very fast and very accurate solution. And just from a couple series of scans, scan of the prosthesis in the mouth, a 360 of the prosthesis outside the mouth, and then a scan of the tissue and the opposing and bite, we can design a prosthesis for you to pick up those housings chairside and get them into a nice updated prosthesis. Now, a lot of doctors don't love doing that because of the nightmare scenario of locking that prosthesis in the mouth. It's never a fun day when you lock in an overdenture trying to pick up the housings. So we have a great solution that is a digital workflow, no models necessary on your end, no analog records whatsoever when utilizing our ArchBridge for Overdenture. So once we receive these records, we're able to process your final, or we could do a try-in, but typically we can process that final overdenture with the 4 sites or the updated new sites here at the lab without any kind of model work. So this is a brand new solution for you that makes your lives a lot easier and a lot less appointments. So with our ArchBridge for Overdenture solution, it'll be some of the same iOS scans. First, we'll want a 360-degree scan of the prosthesis. Then we'll want the opposing and the bite. The next step, you'll take your ArchBridge scan bodies and they'll seat on each of the overdenture abutments. So you'll have those overdenture abutments in the mouth, seat the ArchBridges on each one of them, and then you'll do a scan across the arch, capturing each one of the ArchBridge scan bodies. Once we have that data, then you will send that back to Rowe and we will design a prosthesis that you can seat. The next appointment is going to be your final prosthesis. So we can do a Locator fixed prosthesis for your final. Or if they don't want a Locator fixed prosthesis for whatever reason, we can still do that same workflow if you added additional implants for an overdenture, just to get a little more stability for that patient and their prosthesis. So whether it's a revision case surgically and restoratively, or just a revision case restoratively, we have some great workflows for you to help save chair time and get that patient in their updated and new prosthesis much faster. To learn more about these revision cases and the different workflows we can do, give us a call here at Rowe and let's have a discussion about the patient's current condition and how we can get them ultimately in a brand new updated prosthesis. Thank you.